Okay, let's dive in. Today, we're unpacking something that touches pretty much all of us at some point.
Hmm.
Healthcare quality.
Hmm.
We've got quite a stack of material here. It takes us from the very, the global bodies setting standards right down to something really personal you might face as a patient.
Yeah, choosing your hospital room.
Exactly.
That's right. The sources we've been digging through, they cover, well, everything from major international accreditation groups to national standards like in India.
Right.
And then how hospitals actually do this stuff, how they implement these pretty rigorous requirements.
And then, like you said, how it lands for the patient. That specific decision,
Yeah.
shared room, private room.
Yeah.
So our goal in this deep dive is really to connect those dots. We want to pull out the key insights so you understand the systems working behind the scenes, trying to make healthcare safer, better, and see how all that complex effort actually affects you right at your bedside, influencing choices like your room. Let's get into it.
Okay. So starting with the big picture, the material really highlights Joint Commission International, JCI. They come up again and again as, a recognized global leader in healthcare quality and patient safety.
And their mission statement, it's pretty bold, isn't it? Something like, to enable and affirm the highest standards of healthcare quality and patient safety for all.
Yeah, it is. Speaks to a universal goal, really.
It does.
And the reach is just vast. We're talking operating in over 70 countries.
70?
Wow. Yeah, accrediting, certifying over 1,000 programs globally. And they've got like 600 experts supporting this work.
Okay, so this isn't just, a Western thing.
Not at all. Asia, Europe, the Middle East, Africa, Latin America. They're everywhere.
So how do they actually do that? I mean, what are the tools they use to push for these high standards?
Well, they actually write these rigorous international standards themselves. A big part of that is developing what they call international patient safety goals. These are really specific, actionable things hospitals need to do, like reducing surgical errors or cutting down on infections people get in the hospital.
Right. Makes sense.
And beyond just setting the rules, they offer accreditation programs, certification for specific things too, not just whole hospitals, but like clinical care programs, even newer stuff like healthcare sustainability or telehealth.
Interesting.
Plus, they do practical training, advisory services, the whole package, really.
It sounds like a massive undertaking for a hospital. Why would they sign up for that kind of, scrutiny?
It's a big commitment, definitely, but the sources point to some really strong reasons. Hospitals see it as a clear path to keep improving, especially patient safety.
Okay.
And interestingly, one source mentioned it can actually be a really powerful team-building thing internally.
Huh. How so?
Well, it kind of forces better coordination and communication because everyone's pulling together towards this common high standard.
I can see that.
Plus, it boosts community confidence, gives them a competitive edge, helps with risk management. And, getting that JCI accreditation means you get the gold seal of approval.
Ah, the gold seal. That sounds official.
It is. It's widely recognized.
Okay, that makes a lot of sense. It's like a internal driver, but also this external signal of trust. Got it. Now, let's bring it closer to home. How do these quality standards get applied at a national level? The sources mentioned India specifically.
Right. So in India, you've got the National Accreditation Board for Hospitals and Healthcare Providers, NABH for short.
NABH.
It's part of the Quality Council of India.
And their job is basically the same as JCI's, but just focused on India.
Pretty much, yeah. NABH was set up specifically to create and run accreditation programs for healthcare organizations across India. Their focus is tailored to patient needs there, setting benchmarks for the whole Indian health industry, trying to lift the overall quality.
Okay, so whether it's JCI or NABH, these standards aren't just paperwork. Hospitals have to actually, live them. How does that work on the ground?
That's exactly it. That's where the rubber meets the road. Achieving these standards, and maybe more importantly, keeping them up,
right, maintaining them,
requires a huge internal effort. It means detailed planning, setting up really solid operational protocols for, everything. Patient flow, cleaning, infection control, you name it. Implementing comprehensive quality management systems. It's a constant cycle. Assess, improve, monitor.
Sounds intense and complex.
Yeah.
The sources mentioned that hospitals sometimes get outside help with this.
Oh, absolutely. There are consultancies that specialize in guiding hospitals through this whole process.
Like who?
Supremedic was mentioned in the material, for example. They offer support in lots of different areas.
Gotcha.
It could be anything from helping plan and design the hospital building itself, making sure it actually supports quality and safety right from the start.
Oh, interesting. The physical space matters.
Hugely. Or giving specific guidance for getting NEBH accreditation, optimizing daily operations, even helping with critical infrastructure planning, like making sure the medical gas pipelines are properly set up.
Medical gas pipelines. Okay, that's specific.
Well, think about it. That's directly tied to patient safety in operating rooms, ICUs.
Right, of course.
It just shows how deep this goes. It touches everything from the blueprints to how things are done every single day.
That connection to infrastructure is fascinating, how the building itself impacts safety. Okay, so we've gone from global policy to national standards to the nitty-gritty inside the hospital. Let's pivot now. Where does all this land for you, the patient? Specifically, that very personal decision, choosing your hospital room.
Yeah, this is where those big systemic efforts really hit home for the individual. Choosing between a shared room and a private one. It's way more than just comfort.
Right.
It seriously impacts your recovery environment, your privacy, obviously the cost, and crucially, your potential risk of infection.
Ah, the infection risk.
Yeah.
That ties directly back to the safety standards we were just talking about.
Exactly.
Okay, let's break it down. First, the shared room. Based on what we read, what does that typically look like?
Well, in India, the sources describe general wards that can have, quite a few beds, maybe 6 to 10, sometimes even more, in one big space.
Wow.
Then there are also rooms called shared rooms, which might have fewer beds, say 2 to 4, but typically you're sharing a bathroom with everyone in that room.
Got it. And what are the upsides? Why choose a shared room?
The biggest one, hands down, is cost.
Yeah, I figured.
The sources gave an example range in India, something like $1,000 to $4,000 a day. That's a lot less than a private room. For many people, that's the deciding factor.
Makes sense. Anything else?
Availability is another thing they're often easier to get. And for some patients, there's actually a social aspect.
Social? In a hospital room?
Yeah, being around other people can create a sense of community, maybe some camaraderie. Some people find that supportive, especially if they're in for a long stay, or maybe for older patients who might feel a bit lonely otherwise.
Interesting perspective. Okay, now the flip side. What are the cons of sharing?
Privacy is the big one. You're basically sharing everything, your space, your conversations, even moments during medical care with strangers and their visitors. Noise and disturbances are also much more likely. Other patients, machines beeping, visitors chatting, staff coming and going. It can make getting good rest, which is so important for healing, really tough.
Yeah, I can imagine.
Yeah.
And what about that infection risk again?
The sources do indicate a slightly higher risk inherently, just because you're in closer proximity to more people.
Right.
Now, good hospitals with strong standards like JCI or NABH accredited ones have strict cleaning and infection control everywhere.
Sure.
But the shared environment itself just presents more potential contact points.
Okay.
Also, doctor visits might feel a bit quicker since they have multiple patients right there. Amenities are usually pretty basic, and visitor access is often more restricted just to manage the shared space.
Okay, that all connects back to those quality and safety protocols. Now let's shift to the private room. What's the setup there?
Simple enough. A room just for you, exclusively for one patient, and almost always comes with his own attached bathroom.
Right.
The sources also mentioned fancier options like deluxe or suite rooms, which just add more space or luxury amenities.
And the key advantages. What makes people choose this?
Privacy, number one. You have your own space, control over your environment, the lights, the temperature, quiet.
That quiet part sounds pretty crucial for recovery.
It really is. It generally leads to a much quieter setting, which is huge for getting better rest, better sleep quality. That's essential for healing.
Does it affect the actual care you receive?
Potentially, yes.
Yeah.
The sources suggest you might get more focused or personalized interaction with staff. They're only attending to you in that room, maybe fewer immediate distractions.
Okay.
And critically, going back to safety standards, being in a single room significantly cuts down your risk of catching something in the hospital. Fewer germs floating around, less contact with other patients.
That's a big one. And I bet it makes a difference for family visiting, too.
Oh, absolutely. A private room offers way more flexibility and comfort for visitors. More space, usually less strict visiting hours, though hospital policy still rules, of course.
Right.
And often there's space for a family member to stay overnight, which can be incredibly helpful for support. Plus, you usually get better amenities, PV, AC, Wi-Fi, maybe a comfy chair or sofa for an attendant. Doctor visits might also feel less rushed, allowing for more detailed chats.
Okay, it definitely sounds like a more comfortable, maybe even safer environment for recovery.
Yeah.
But there's got to be a catch.
The main catch is the cost. Private rooms are significantly more expensive.
How much more?
Well, the examples for India in the sources started around $3,000 a day and went up to $10,000 or even way higher for the really plush ones.
Okay, that's a substantial jump.
Definitely.
And while you get privacy, you lose that social connection you mentioned earlier.
Exactly. For some people, especially if they're naturally outgoing or facing a really long stay without many visitors, that isolation can be tough. It can lead to feeling lonely.
Right.
And just practically, they might not always be available. Private rooms can fill up, especially during busy times.
Okay, so we've got cost, privacy, rest, infection risk, visitor needs, all these factors, and they're all kind of influenced by those quality and safety standards humming in the background.
Yeah.
How should someone actually make this decision? The sources laid out some key things to consider.
Yeah, they boiled it down to several really crucial points. First off, and this is huge, understand your health insurance.
Absolutely critical.
You have to check your policy's limits on room rent. Does it even cover a private room? If it does, what's the maximum amount per day they'll pay?
Because going over that limit means...
It means you could be paying a lot more out of pocket or have a higher copay. You really need to call your insurance company or talk to the hospital's billing department and get the exact number for your maximum covered room rent. Don't guess.
Good advice.
Yeah.
What else? Your medical condition itself must be a big factor.
Totally critical. If your illness means you absolutely need quiet to recover, or if your immune system is weak and you're at high risk of infection.
Or if you're contagious, maybe.
Right. Or if you have something contagious and need isolation, then a private room might actually be medically necessary, or at least very strongly recommended. These are direct links back to patient safety.
Okay. What about how long you expect to be in the hospital?
That matters too. If it's a really short stay, maybe under 2 days, the hassles of a shared room might be okay. But for longer stays, the comfort, the quiet, the privacy of a private room can make a really big difference in how well you rest and heal.
And then there's just personal preference.
It really is. Some people just value privacy above almost everything else. Others might actually prefer having some company around, maybe find the shared room less isolating. You need to know yourself and what you're comfortable with.
And then back to money the budget.
Yep. After you figure out the insurance situation, you have to be honest. Can you actually afford the higher cost if insurance doesn't cover it all? Or if you go over your limit? It's also smart to ask if room costs are part of a package deal, like for having a baby or specific surgeries. And definitely clarify about any upfront deposits or extra fees tied to the room type.
Okay. And finally, thinking about family and visitors.
Super important. If you know you'll need close support from family, or if you want them to be able to visit flexibly or even stay overnight,
Then the private room is much better for that.
yeah, it just offers a much more accommodating space for them to be there and be part of your care.
So it really is this mix, isn't it? Your medical needs, your personal comfort level, your financial situation, all happening within this framework of quality standards the hospital is trying to meet.
Exactly. It's a really tangible point where the big, complex system meets your individual journey as a patient. There's just no single right answer for everyone.
Wow. Okay, we've covered a lot of ground here. We went from these huge global efforts by bodies like JCI, understood the national picture with NABH, the role of consultants helping hospitals.
Right, the practical implementation.
And brought it all the way down to that very personal space where you actually heal your hospital room.
Yeah, and it really highlights how trying to improve quality and safety isn't just some abstract goal. It's meant to impact every level, including things like how quiet your room is, how well infection risks are managed right there, even how your interactions with staff might feel.
So that choice of room, while it feels very personal, it's actually shaped and influenced by these much bigger efforts towards quality and safety. It's where the macro meets the micro, right at your bedside.
It definitely makes you think differently about what goes into that daily room charge on the hospital bill.
It really does. Which leads us to a final thought for you to chew on. How do these massive complex systems aiming for global healthcare quality actually translate into the feeling of safety, the quietness, the privacy you experience or don't experience in your hospital room? And what does that gap or that connection tell us about the ongoing challenge of making healthcare not just high quality and safe, but truly accessible for everyone? Something to ponder until our next deep dive.